Flu season, it's been bad in the past few years, but this time it's horrible.
Flu cases are high across the country. It is the worst season for respiratory illnesses in more than 25 years. Hi there, I'm Madeline Carter. The CDC says more than 15 million flu cases have been reported so far this season, and we have not even hit the peak yet. This map from the CDC shows what flu activity looked like across the country after the holidays in early January. You can see around 24 states in purple and burgundy, like Colorado, New Mexico, Texas, Missouri, and Louisiana. That means they're experiencing very high flu levels. The dozen or so states you see in red and orange, like the West Coast, Arkansas, and Florida, are seeing high levels of the flu. Roughly 180,000 people have been hospitalized and 7,400 have died. Most of the cases are from a new severe strain called subclade K.
We have very little background immunity as a population, and this lack of immunity is allowing this strain of the flu to spread quickly. Remember that even in years when the vaccine isn't a perfect match, as is the case this year, it usually still reduces people's severity of illness.
The CDC estimates 130 million flu shots have been given out across the country this season, but when you break it down, that covers less than 40% of the U.S. population. Flu shots can be given to children 6 months and older. Children under the age of 2 are at a high risk of developing serious complications from the flu. It killed at least 288 children last year, according to the CDC. Most of the children who died last season were unvaccinated. The flu has already claimed the lives of at least 9 kids this season. A doctor in Texas knows the toll the flu can take firsthand. He lost his healthy, active 16-year-old daughter 6 years ago. Teresa Woodard shares his story.
The daughter, who made him a dad, came to this clinic a lot. A flower she drew on a note she left still hangs over his shoulder.
It's paradoxical because 6 years ago feels like just yesterday, but 6 years ago also feels like it's an eternity. That's how it feels like. That's how it feels like when your child dies.
Reese Termolo got a fever. Her pediatrician father suspected the flu. He was right. And a healthy, active teenage girl.
She passed away January 10th, and her first fever was January 9th.
Was gone in 24 hours. Reese had a flu shot, but that season's vaccine did not protect against the strain she caught. Dr. Cesar Termolo still believes shots can and do save lives, so he tells every family to get them. And he's disappointed these days at how many families don't.
If I could just tell them, my daughter died from the flu. These things happen, and you have to be able to take the flu seriously.
Reese was a 16-year-old sophomore. Still loved, still missed, still present. In Dallas.
Reese lives on through you every moment of every day.
Right. She's always here. She's always here.
I'm Teresa Woodard.
The CDC reports the rate of kids and teenagers hospitalized with flu nationwide is the second highest in 15 years for this point in the season. Apart from children, the flu can hit people over the age of 65 especially hard. Others who are also at higher risk of developing serious complications are people with asthma, those who are pregnant, and people with certain chronic conditions.
Some people can get the flu, you feel terrible, you get a fever, you get body aches, you have cough, runny nose, and you improve at home. But others don't. Young children or adults with asthma or other underlying lung or neurologic disease, or older adults are all at higher risk of having a complication of the flu and requiring hospitalization. That's where preventing the flu with a vaccine is really important, and also reducing the severity of those complications.
Common flu symptoms include fever, cough, body aches, and fatigue. Doctors also say that they're seeing a lot of gastrointestinal issues with this new strain. If you start feeling better, only to then get worse again or develop pneumonia on top of all those symptoms, that's when it's more serious and you should call your doctor.
Anytime that you're really sick, you're having trouble breathing, you're getting short of breath if you walk, if you're confused, if you are dizzy when you stand up, those are the times that you would call your doctor or even go to an emergency room.
Prescription flu antiviral drugs can treat the illness, but they need to be started as early as possible. Some hospitals are right now struggling to keep up with the number of people who need treatment for the flu. In Maryland, some hospitals have reported longer wait times. Randy Hildreth talked to doctors about what they're seeing.
Doctors say if you feel very, very sick, absolutely go to the emergency room, especially if you are elderly or immunocompromised and over-the-counter medicine isn't working. But they are warning of long wait times because a lot of people are sick right now. It's an achy flu season that's topping previous records.
Emergency department and urgent care visits that are about 3.5 to 4 times higher than what they were this time last season.
Hospitals are already handling everyday emergencies, but spikes in respiratory illnesses like the flu are stretching resources.
There's a lot of patients.
Dr. Marissa Weiss is the medical director for the emergency medicine department at the University of Maryland Capital Region. She says hospitals are having to hold severely ill patients in the emergency department as they wait for beds to open in the hospital.
Find new spaces to see emergency medicine patients that are coming in because of our boarding patients in the ED. It's really every hospital in the DMV area.
They're not yet at peak levels, so that suggests that there may be continued pressure, likely going to experience longer wait times, and to come prepared with their patients and their masks.
The University of Maryland Capital Region says it's increasing staff and expanding care spaces to accommodate the surge. Doctors say this year's flu shot isn't a perfect match for the bug, but they say still get it. It still offers some protection. And they're reminding everyone about the basics: hand washing and covering your mouth when you sneeze or cough.
Some hospitals are temporarily updating their mask policies during this flu surge. Some are having their employees mask up to prevent the spread. Other hospitals, like in Hampton Roads, Virginia, they're requiring patients with flu-like symptoms to wear a mask after an uptick of cases in the state. There are ways to find out if you're sick from home. Alex Lai looked into at-home flu tests and talked to a physician to see how reliable they really are.
Home COVID testing became popular a few years ago, and then less than a year ago, combination COVID and flu tests hit the shelves. Working for you, I looked in to see if these at-home tests really can detect the flu. In today's age, staying home sick means you can get medicine delivered to your door, visit your doctor via telehealth, and now test for the flu from your bed. Working for you, I spoke with Sharpreece Steely, Dr. Jotu Sandhu.
Traditionally, the flu home tests are antigen-based, which means they have a modest sensitivity, but a pretty high specificity.
That means antigen tests are good at ruling out people who don't have the virus, but not as reliable at confirming when you do. However, molecular flu tests have high specificity and high sensitivity, making them less likely to miss a positive case.
If that antigen test is negative, you want to still be cautious because you could still have influenza. But if you're doing a molecular test, you can be pretty assured that whatever answer you get is the right answer.
But molecular tests are harder to find. The only at-home molecular flu and COVID test, Lucira by Pfizer, was discontinued in May. It sold for around $50 to $80 per test. Most at-home kits on shelves today are antigen tests costing $10 to $15. Insurance typically won't cover them, but many are eligible for HSA or FSA accounts. If you want a more accurate molecular test, many hospitals and urgent cares use them. Dr. Sandhu says the best time to test is within the first 5 days of symptoms.
Influenza kills about 50,000 people per year. Most people who get infected won't die from it, but it's important that you get tested at home and tested soon so you don't spread to people who are more vulnerable to more serious disease.
How effective is this year's flu shot against the new super flu strain? Coming up, a health expert explains new studies and what we know. Plus, we break down why flu cases rise during colder and drier temperatures. We've mentioned the new aggressive flu variant. It's being called the super flu, or subclade K. It is now the dominant flu strain in the United States, but there is a glimmer of hope. The flu shot might offer stronger protection against this strain than previously thought. Our station in Denver spoke to their health expert to learn more about it.
Our health expert, Dr. Paul Coley, is here to talk about that with us. I know that every year the flu comes around, and I've heard people say, I've said it myself, I'm not going to get the flu shot this year because it's never It's never good enough to protect everybody from everything, but this year specifically.
Well, this year, it's kind of funny. We didn't expect it to be good because this new variant, the superflu, the subclade K variant, H3N2, came out after the flu shot had already gone into production. So we said, okay, we missed the boat. It's probably not going to be very good. But UPenn just did a series of studies that shows us that, in fact, it is offering really good protection. So every year, most flu shots have protection against flu A and flu B. So this year's shot has 2 strains of flu A and 1 of flu B. And one of the 2 strains of flu A is the parent from which the superflu, the subclade K variant, descended. So they gave these people the flu shot and counted their antibodies before and after, and they went from 11% to 39%. So 4-fold increase in the antibodies against this variant. So if you haven't gotten the flu shot so far this year, I know it sounds like a broken record, but it's not too late to get it because that flu is really, really severe.
It's as you've seen it, I mean, it's leading newscasts on national level too. It's everywhere in the country. ERs are filled. So when it's pretty effective, does this also mean if you do get sick, you're not going to be as sick as somebody that hasn't had the vaccine?
100%. In fact, there is a 50 to 65% reduction in risk of hospitalization, risk of ICU admission, and risk of death, particularly in the highest risk populations. Now, what's interesting this year is normally we say, oh, the younger and the older are the highest risk, right? This year, we're also seeing the young, healthy people being high risk. And part of that is because they haven't been immunized for the past few years. And so their immune system's gotten a little lazy and has not seen the parent of this H3N2, the superflu subclade K variant. So they don't have any antibodies at all. So we're seeing a fair number of young, healthy people also ending up in intensive care. So as you said, Kim, even if it's not going to prevent infection, which is not what we're looking to do, it's going to prevent you from getting really sick.
Yeah, and it's not just about that too. There is a correlation between the flu and heart disease?
Yes, as a cardiologist, I love this. I love telling my patients this. So if you have heart disease and you get the flu, you're more likely to die or get sick. But the opposite is also true. If you have heart disease and you get the flu shot, you're less likely to have a heart attack, a stroke, or have a cardiovascular complication, including heart failure. So we really do recommend it. It's in the American Heart Association guidelines for every person, obviously who has pre-existing heart disease, but even those that don't and those that have cancer to get it. And the more people that get it, I like to say it's sort of like a little deposit in your immune system's savings bank. Because, for example, the people who got the flu shot last year, they're having better protection against the subclade K variant because it descended from the H3N2.
So your body is taking on that. So what's the season? Because that's the other thing I always wonder is usually we talk about it around November. I know it was an earlier start here.
Yes.
Prior to the holidays. When does it kind of die off?
So this year, because it's more aggressive, it's an earlier start, a bigger peak, and a longer tail.
So
it's going to be worse than
I thought it was going to be over like in 2 weeks.
You don't get any relief.
In fact, it's spreading more and more and more because the more it spreads, the more it mutates. And so I like to call the flu the shapeshifter virus because it mutates so efficiently. So it's almost like recognizing somebody with a different hairstyle, different clothes, different everything. Every week it changes the way that it looks. So because of that, we're expecting to see a much longer tail, which is why we're saying people should still
go get the shot.
Vaccinated.
I feel like it's always a good idea, and this is the last question we have time for, but if you didn't get whether you got it or not, you say go get the flu shot, that's your advice. What can people do if and when they get it to lessen the effects, and when do they need to go to the hospital?
Such a great question. So the minute you feel any respiratory symptoms, don't just guess, don't just say I'm under the weather. Get one of those over-the-counter tests from Walgreens or CVS or King Soopers or something. Swab yourself for both COVID and flu, because within those first 48 hours, you can either get started on Paxlovid if you have COVID or on Tamiflu if you have flu, and that reduces the duration of symptoms, reduces how infectious you are to others, and reduces the risk of complications. And then, of course, the usual stuff of staying in bed and keeping yourself isolated. They are working on a better flu shot for next year. It's called a modified RNA flu shot. So I'm hoping that one's a little more effective.
Some of you might be wondering why flu season always seems to be worse when the weather gets cold. Well, here's a look at how temperature and humidity impact the virus.
Let's start with temperature. The flu loves colder weather. It's surrounded in a fatty outer lipid. In warmer temperatures, the virus's outer coating becomes less stable. In colder air, that outer layer stays firm, helping the virus survive longer outside the body. But an even bigger factor is humidity. The flu likes dry weather. The lower the humidity, the better for the flu. Dry air lets the virus particles stay airborne longer and dries out nasal passages, which weakens our body's first line of defense. Dry air causes respiratory droplets to evaporate into tiny aerosols that can go deeper into the respiratory tract. In humid weather, larger flu particles fall to the ground faster and are easier for our immune system to spot and attack. Combine all this with the fact that people are spending more time indoors when it's cold, this gives the virus a better chance to jump from person to person. So what can you do? Research shows that keeping your indoor environment a tad more humid in winter may help. The sweet spot is what scientists call the Goldilocks zone, where indoor humidity levels are between 40 and 60%. Studies have found that the transmission and effectiveness of the flu virus dropped at a daycare where the indoor humidity was higher.
Up next, doctors share their concerns on the new federal vaccine guidance for kids amid the spike in flu cases across the country. As flu cases spike across the country, some doctors say new federal vaccine guidance is making it more confusing and challenging for families to know how to stay healthy. Pearl Small spoke with doctors in Maine.
To be sitting in the midst of a flu season that just feels like a tidal wave.
In one of the worst outbreaks that Topsom pediatrician Alyssa Goodwin says she's seen in her whole career, 9 children have died from the flu this season.
I think we already were seeing impacts of what has now been enacted, even prior to this recommendation coming.
The rise in cases, as well as the severity, makes Goodwin believe it's connected to a drop in vaccine rates. And now new vaccine guidance for children coming down from the federal CDC has influenza removed from the universally recommended list of vaccines. It also changed RSV to only recommended for those at high risk. The adjustments affected 7 vaccines total.
And to be clear, this recommendation is not based on any evidence or science.
As the messaging changes, Maine health officials say the public may have to change where they get their guidance.
It's just a great opportunity for us as a health system and as us as providers to sit with our patients.
Dr. Charles Morris, Chief Medical Officer for Maine Health, says they will continue to push the previous vaccine schedule, which he says is based on professional societies like the American Academy of Pediatrics and the American Academy of Family Physicians.
These are groups of experts who have always issued their support and recommendations based on the evidence. We find that evidence very compelling and it makes sense to us.
And the Maine CDC says there's no requirement to implement the federal changes.
It really then it's up to the states on whether or not this is guidance and recommendations that we would like to follow.
Health Secretary Robert F. Kennedy Jr. said the CDC made changes to the childhood vaccine schedule to, quote, rebuild trust in public health. The flu season typically runs until March, so experts say it is not too late to get your flu shot. That does it for us today. We hope you found this information useful to keep you and your family safe and healthy. I'm Madeline Carter. See you next time.